Do no harm chairman and former UPenn Associate Dean Dr. Stanley Goldfarb is here to react. Doctor, not to be graphic, but if my chest is literally split open and there's a surgeon standing over me trying to save my life, why would diversity, equity, and inclusion matter one bit in that OR?
Well, good morning. Of course it wouldn't matter at all. And that's exactly what our organization is trying to push back against these standards, because they really don't speak to what physicians really do, which is to care for sick people rather than become either social workers or social warriors in a quest to change characteristics of American life. And these standards are incredibly political, ideological, and really will do nothing to improve the health care of any group in America, including African-American patients at whom it's really aimed.
Let's drill down to the specifics. They are shocking. Here are the new standards. They include understanding oppression, white privilege, social risk factors, race as a social construct, and as if that wasn't bad enough, colonialism. What will this do to the training of our next generation of doctors?
Yes, and I think what your audience is seeing now is the fact that critical race theory has now come to medical school, and the concerns that have been expressed about that for secondary education and even primary education now comes to medical education. And it will do nothing to improve the health of the American people and do nothing to improve the health of the target audience here. This is an idea to create physicians to be advocates for various ideological positions and to encourage them to vote for candidates that are going to support these positions rather than a series of issues that are going to improve the way healthcare is delivered, which is really what our organization is concerned with. And I must say our organization is interested in hearing from individuals in healthcare who have seen some of these activities go on in their schools and their hospitals. And we've really benefited from tips that they've sent in to donoharmmedicine.org about these kinds of activities.
Is the goal to ultimately treat patients differently based upon their skin color?
That's exactly right. And that's what critical race theory calls for. Dr. Ibram Kendi has said that past discrimination requires present discrimination, and present discrimination requires future discrimination. So the idea is that historical wrongs have to be dealt with and corrected by present wrongs and future wrongs. And this discriminatory activity in healthcare can only lead to more divisiveness and a different standard of care for people based on their skin color, which I think Americans just reject.
It says students must master this stuff. What does quote-unquote mastery look like? And if I refuse because, I'm there at medical school to become a doctor, do I not become a doctor if I don't master this stuff?
Well, this is a problem. This will be embedded into the various licensure exams because the Association of American Medical Colleges has an important say in the way licensure exams are constructed. So students will be expected to answer the questions correctly when it comes to presenting this information. And we certainly have many students that have written to us, to our organization, complaining about this. We have one student who famously told us that I've had more lectures about pronouns than I've had about kidney disease. And this clearly can't benefit the medical students and certainly can't benefit the health of the American people.
At a time when we are desperate for new doctors because healthcare is at such a premium right now, we don't need this. This is not helping. Dr. Stanley Goldfarb, thank you for doing what you're doing. You will save lives in the process by doing this. We appreciate it.